Hello, and welcome to this special session of the National Community Connect Group. This evening, we have a special guest speaker, Michelle Hastings, who's going to talk about what it's like to have to navigate the workplace with a primary immunodeficiency, more specifically, common variable immunodeficiency. The talk was originally presented as part of a special panel on patient experiences in public places. And this was at the Alberta Education and Awareness Day in 2024. So, behind this was the idea that primary immunodeficiency is more than just a set of symptoms, but can also have an impact on all facets of a person's life, including social and environmental interactions. In this case, Michelle was asked to talk about the workplace. So, this evening, she's going to share her personal journey in what is a very honest and heartfelt talk, which will shine a light on the challenges, the misconceptions, and small acts of compassion that can make a big difference. She's going to do a 15-minute presentation, and afterwards, there'll be a short 15-minute question and answer session. But first, a brief introduction to our presenter. So, professionally, Michelle's a registered nurse and has previously worked within the oncology setting. She's a mum to three adult men, loves to host family gatherings, and is happiest when she's in the great outdoors. Michelle's also a volunteer from Immunity Canada, and she currently facilitates the online older adults peer support group known as Community Connect. Her goal is to help people navigate through their diagnosis and support them along their journey. So, Michelle, welcome, and it's time to hand over control of the Zoom screen to you.
Thank you very much, Fiona. Um, Welcome, everyone. I just would first like to thank Immunity Canada for giving me this opportunity to share my journey to being diagnosed with a primary immunodeficiency, specifically CVID, and also my recent experiences within the workplace. I specifically do want to thank Fiona for all of her help, support, and a lot of laughs over the last couple of years while I have been volunteering for Immunity Canada. Okay, so basically, the outline for today is my personal journey with CVID, my late diagnosis, and other delays, working from home, the triumphs, trials, and tribulations, duty to accommodate, which was revoked in 2023, the physical mental health impacts resulting from the duty to accommodate denials in the workplace, advocacy awareness for employers, conclusion, and resources if requested. Um, Basically, my goals are to not pass out from my nerves. Just kidding, but I hope to bring awareness to our struggles and the challenges that people with PI can face within this workplace or within their workplace, I should say. And that is hopefully in turn is going to result in more discussions around this topic, which will result in better awareness to employers on why accommodations can be greatly effective in the workplace for those with our conditions. I plan to provide you with some information on different things that I personally have found to be helpful and maybe not so helpful to myself. But please note that the views expressed today are my own and are not intended to be legal or medical advice. This is my personal experience, and any information provided is for informational and educational purposes only. I remember back when I was around 8 years old, my dad was extremely worried about all the ear infections, colds, tonsillitis that I was having. So he took me to my family doctor and said, please check her blood or something. Something's not right with her. Back then, he would have drawn a CBC, which is basic panel blood work, and it was all normal. I was so sick all the time. I was constantly on antibiotics. Like many of you know this story, frequent colds, ear infections, tonsillitis, resulting in removal of my tonsils at age 8. I really love Jello till this day from being in the hospital. My young adulthood was started with sinus infections, and from there, just ongoing. I felt like antibiotics weren't working for me, and later on discovered that I was having rebound infections. Therefore, meaning I require, and many others like me require longer courses of antibiotics compared to the normal population. I was labeled by many and I was teased by most as being sickly, pale, and weak. Then all the suggestions would come to me. Do you take vitamins? Are you getting enough sleep? And then the comments of "you're sick again." That's a really bad cough. And my favorite, "you're a hypochondriac." Ultimately, I was left to feel that I wasn't doing something right. I was causing my illness. I was weak, sickly, and it made me feel less than. Yes, our stories tend to sound awful, and we are telling them as we are telling them. And yes, definitely, it was not an easy time in my life. But honestly, despite all those illnesses during my school years, and despite feeling different from my peers, my memories are filled with wonderful childhood. I grew up in a small town of Killarney, Manitoba. I had supportive and loving parents and a sister whom I was and am still extremely close to. I had good friends, cousins. I did well in school and I was very active in sports. I was a competitive figure skater where I even had my very own key to the rink so that I could practice early mornings. Before school, I played volleyball, track, took swimming lessons at our local beach in the summers. Honestly, I feel that my youth brought forward the birth of my journey towards resiliency. At the age of 17, I moved away from home, started my post secondary schooling, and in 1989, I graduated from the health sciences in Winnipeg and I was officially a registered nurse. This is my 35th year as an RN, which is really weird to me to say. Um, in my mid 20s, along came my three boys. They were and still are the brightest light in my days, especially during those dark, difficult days where the infections were becoming relentless. Then I started getting different weird infections, like numerous bouts of mastitis from breastfeeding, where at one point the mastitis was so bad that my mom had to come over and help me with the boys. And she later told me that she was sure I was dying as I was lying there in the tub, hot as could be, the hottest tub you could get. And I was shaking with rigors, ash in color, and just trying to get my fever to spike because then my body usually warms up after that. So for me, having a fever is awesome, whereas the lead up to it is horrible. And then a day after my youngest son Ross was born, I woke up in the morning with a drooping, slanted face, wide opened eye, and a drooling mouth. Thought I had a stroke from the pregnancy, but I was diagnosed with Bell's palsy. However, the day after that, I woke up and I had a shingle on my ear. I thought it was a scab, but it was a shingle. So they later diagnosed me with Ramsay-Hunt syndrome, which is very similar in presentation, however, worse outcomes, whereby most don't achieve a full recovery. 6 months had gone by. I had zero improvement. I could feel everyone gawking at me like I was a freak. I even had an EMG test and was told I would never regain any function in my face. I was devastated, and honestly, it was one of the hardest times in my life. Then, luckily, I met a mom at the school in kindergarten. Well, my oldest was in kindergarten, and she had Bell's palsy and told me about Dr. Stephen Ung. He's here in Edmonton who does acupuncture. After 3 treatments, my face recovered to the way it is today, which is, I would say, 80% recovered. However, now there's more wrinkles, of course. I will be forever grateful to Dr. Ong. It was also the beginning of my propensity for Eastern medicine and alternative therapies. Jumping back to antibiotics, though, the reason I would wait. So I waited a long time, which I ended up with the Bell's palsy. At the time, he did an x ray, saw a full blown sinus infection in my sinuses. And he was like, "Why did you wait?" The reason I waited is because we're in a world of the doctors were refusing to give antibiotics anymore. It was very stringent, um, almost impossible. And so I started to feel like I was like a drug addict begging for a script for antibiotics. I literally would go to different walk-in clinics across the city because I didn't want them to know or think I was a user of antibiotics. Next slide, just be aware, some of you may be grossed out, but D-Day, which I call D-Day Diagnosis Day, April 2nd, 2019. Life carried on, as did all my illnesses. One of my worst sinus infections, the pussy mucus would come out of my eye as I was blowing my nose. It was awful, as you can see in the photo. And Another time, pneumonia, pleurisy. I remember crawling up the stairs to make sure my kids got off to school okay. And then finally, after major infection, after sinus surgery, and the surgeon refused to give me antibiotics, I ended up losing my hearing for weeks. At that time, my family doctor finally referred me to see an infectious disease doctor. He did my immunoglobulins for the first time, and they were extremely low. He was originally kind of puzzled, and I think it was because there's, primary immunodeficiency, and then there's the secondary. And because I was the age of 51, he was puzzled that I had gone this long without being diagnosed. But he did not give me a diagnosis. He referred me to hematology. Hematology wait list was 2 years. So I saw Dr. Osmond, my hematologist, fantastic doctor. I'll never forget that day. Um, I saw him. He's first thing he said is, "Why am I seeing you just now?" And I was looking at him, what do you mean? And he goes, "How did nobody pick this up before now?" And he said, "Let's start at the beginning." And he went back through all my childhood. And he was the first doctor to really sit and listen with interest and not, with that kind of condescending, roll of the eyes look of you're a hypochondriac girl. The tears just started flowing down my cheeks at that appointment because I was so grateful for his concern and attention to detail with my history. And I was almost elated with the diagnosis, which is weird. However, it was just getting a name, just getting validation finally for all of these things that I've gone through my entire life, and the people saying, "Why are you so sick? Why are you so sick?" Um, but then the overwhelm set in. This is not curable. It's chronic, lifelong. It has risks, increased chances to also acquire other diseases like autoimmune ones, lupus, cancers. But there was treatment available. It was a life-changing diagnosis. Beyond managing my health, I quickly learned that CVID would limit the way that I would engage with the world, especially as a registered nurse. For someone with CVID, every shift in a hospital or clinic becomes potential battleground. The risk of infection is constant, and even a minor illness can escalate to something serious. You have used up all your sick hours because you have to go to work ill. And I used to hide in patients' change rooms, coughing when I get a coughing attack when I was sick because I was so embarrassed that I was at work sick. Um, then I had a treatment delay. So the plasma shortage here in Canada, I couldn't get treatment for another 6 months. And then after my first 3 months of treatment, COVID started. Um, my then manager was extremely supportive, allowed me to work from home from March 2021 till December 2023. I was working successfully from home. I was grateful. I had an increased drive. It was a new area working in the healthcare field. I embraced it and set up my own home office out of my own pocket because it is government. My quality of life improved immensely, both at home and work. Uh, I had to set boundaries to stop working because I had a tendency to work longer hours. It was just right across the hall for my office. I was grateful to be at home with my dogs, easier to go outside on breaks and get some air. And I only had one sinus infection in the first year of working from home. During those, and usually it's 5 or 6, during those 4 years of working from home, like I said, less infections, less sick hours, and also a more livable life outside, um, outside of work because no commute. So you factor in about 2 hours of commute getting ready for work, and that 2 hours I could use at living life because most of us have the fatigue. And so, you don't have the same amount of hours in a day that a normal person would in the sense of how much energy you have. That's my personal experience anyway. Um, so I think that managers fail to realize that accommodating employees with our conditions um, will actually benefit them as much as it can benefit us because remote work means fewer sick days for your employees, better productivity and peace of mind. And for us, like I said, the commute, And as a result, the extra ability to live more normal life. It's more positive, productive during work hours as well. Um, the Unfortunately, I had to take a leave for my two hand surgeries, which was not carpal tunnel. It was not a simple surgery. They were pretty invasive. Took out bones at the base of both my thumbs, and then transposed a tendon out of my arms down into the hole that they made. But excellent surgery, life changing. I have no pain in my hands. I can function and use them perfectly without pain. When I returned to work on my first day back, my new manager, different manager, told me I would no longer be working from home and I would be placed on the front lines in an area I'd never worked before. Um, she told me that it was no longer an option to work from home because the position I was in was no longer going to be available. However, that was a lie, outright lie. This decision was not based on my performance or capability. It was simply a lack of willingness to accommodate. I say it's a lie because we're well into a year later, and two retired nurses who I was working with and were covering me when I was away are still working in the same job. Um, and so I have been fighting for this accommodation ever since. During all of this, I became incredibly ill, both physically with increased infections in every part of my body, and mentally with trauma and panic attacks overtaking my life. For those with CVID, lack of accommodation isn't just inconvenient, it is life altering. Every day spent in environments that expose us to unnecessary risks can mean serious illness or hospitalization. And when they refuse to acknowledge this, they're effectively saying that our safety and well being is not their concern. This strain extends beyond the immediate situation, it impacts every facet of life: mental health, physical health, professional identity. The loss of a role that had brought purpose and meaning to me was replaced with uncertainty of what am I doing now and where am I working? And I have to relearn so many skills at my age. CVID just doesn't just take a toll on your body. It weighs heavily on the mind and soul. The constant vigilance, fear of infections, physical exhaustion are draining. But what's even harder is the isolation. To employers, I would say this: accommodations are not favors or exceptions. They are necessities for fostering an inclusive, compassionate, and fair workplace. If an employee has proven that they can excel in a remote role, why would you deny them the chance to continue that? For me and for so many others with chronic conditions, this is not just about working from home. It's about dignity, respect, and the right to contribute to society without sacrificing our health. The trauma of being denied these rights leaves scars, but also fuels a determination to fight for change, so that no one has to endure what I've done, what I have. But what we need is more than individual success stories. We need system change. Employers must recognize that accommodating employees with chronic illnesses is not a burden, it's a legal obligation and a moral imperative. To my fellow individuals with CVID or primary and immunodeficiencies, other chronic conditions, your health matters, your voice matters, your work matters. We must continue advocating for ourselves, educating employers, and pushing for workplaces that don't just accommodate, but celebrate our unique contributions. Things that have worked for me are on this slide. You can see that. I won't read it all. When an employer refuses to accommodate an employee, especially when accommodations are not only possible, but have already been successfully implemented, like in my case, the experience can be profoundly traumatic. The impact was more than logistical or financial, it was psychological. I began to question my worth and my future. Am I being discriminated against because I had to take a leave for a major surgery? Am I expendable? Being forced out of a job I was excelling in sent a clear message that my contributions were less than important than the employer's rigid preferences. Am I asking for too much? Despite my reasonable request, I felt guilt, shame, and though advocating for my health was an inconvenience to, as though advocating was an inconvenience to others. Will I ever be able to work again? The loss of this opportunity made me doubt my professional future, my age, trying to find a different job, amplifying feelings of hopelessness. Here's just some takeaways that are not medical advice. Just got to make that clear. But I've found helpful for myself: trusting, believing in yourself, being strong advocate for yourself. Think about years that you weren't diagnosed, and just always believe in what you're feeling in your body. Um, Big things for me are having a detailed letter from your specialist stating things like she has this condition, this is what she requires, she's on a plasma medication, or that she requires longer antibiotic usage. At the first sign of infection, this is what you need to do, so that your family doctor will follow those things without questioning you every time. And you can also get antibiotics on refill. You just have to ask your family doctor to write it that way, and they will do refill prescriptions. I'm not sure if that's province wide, Canada wide. Um, Big one here, big plug for Immunity Canada, but sign up and attend Community Connect Zoom meetups. Honestly, I have not walked away from one of those meetings without learning something new. Listen to music. It is amazing for you um, in so many things. Like, we have fatigue, and some days you're tired and you just don't feel like doing something. Put on music, and it really can help boost your mood to, give you a little bit of a boost of energy once you get going. Sometimes you find that energy. Be aware of your mental health before it becomes a crisis. And volunteering, huge reward for yourself and for them, for others. And just try to always connect with others and not isolate yourself. It's so easy to just roll into a bubble and get outside. Honestly, I have found so much and I've learned from my somatic therapist and other things that I've done all year. Um, Grounding work is incredible. Meditation. There's so many things out there now for free that you can find online. Finally, I've been able to get my brain a little bit back into back out of fight and flight and freeze, which is your stress, dysregulated nervous system kind of state. Most days I'm into my prefrontal cortex, they call it, where I could begin to start making decisions again and make plans for my future. I still struggle. I fall back into stress, panic a lot, and I'm not fully healed, but I'm on that journey, and I'm no longer a victim to a bully. And I know that my story has not ended. It is just beginning. I feel like I'm starting a new chapter. I got engaged in the past year on a snowmobile trip on the top of a mountain. In the last months, I've learned so much, and although I'm 57, I am not done my career. Um, I have many resources to share with people, and I have a purpose deep down inside. I want to give back to the world. Um, and I have a lot to offer for the workforce. I know that the universe is pushing me in another direction, and it is telling me that there's something um, even better on the horizon for me to discover. Recently, after a Zoom meeting with the older adults, just happened to meet a lady in there, and from there, I followed a path that was shown to me just by chance. And recently, I enrolled in a holistic nursing, nurse coach, and nurse consultant certificate program, where I would become an independent RN at the end of it, working from my home safely and helping others as a life nurse coach. Um, Fantastic program too. I know my life's purpose has been to help people, and I hope to be able to continue doing that in my future. I feel the universe is pushing me in different directions now that I'm able to see. When you're in fight and flight and in that stress mode, we tend to not see what's right in front of us. Things we're just not able to be present, really, is what happens. Um, and I feel strongly that there is even better opportunities out there that are waiting for me to discover as my future grows. Thank you all for listening to my story. Lastly, I'd like to thank my family and friends for their love, understanding, and compassion and support. And last slide is just to thank you for your time. I do have more information. When I did the other presentation, I had pamphlets, but I can't give you those. So if you'd like more information, if you could reach out to Immunity Canada, and then I will provide them with the information I have, and with resources for anybody that's struggling with this. I also offer up my email, Immunity Can through you would get it through Immunity Canada, and I would be happy to help. guide anybody with my experience and what worked for me. And accommodations are not favors or exceptions, they're necessities for fostering an inclusive, compassionate, and fair workplace. Thank you.
Perfect. Okay, thank you, Michelle. Really want to thank you. That was for sharing a very personal part of your life. And I'm sure for many of the people in the audience, it's going to resonate with them, your experiences in the workplace, in
Thank
that you literally had to work through it. Um, so I'm sure that everyone would be giving you a virtual round of applause, if we could,
you.
and for what's a very honest and insightful presentation. So now we're going to turn into some questions. So feel free to raise your virtual hand. Meg's already done it, or type some questions in the chat box. Meg's going to keep a lookout for them and she's going to facilitate the question and answer sessions. So I'm going to hand it over to Meg right now.
Thank you. And thank you, Michelle, again. That was wonderful.
Thank
Um,
you.
don't be shy to reach out. I've got a couple of questions of my own. I'm happy to kick things off, but again, like Fiona said, please raise your hand. Um, One of my questions, Michelle, is in terms of, some of the research you've done around policy and legal documents. Maybe you could share what what prompted some of that research and how you might have navigated that, but what helped you most outside of Immunity Canada
Yeah.
in that?
I think I did different routes because I'm a union employee, and so it's I did a lot of research. That's my background, so I dug up a lot of resources, human rights organizations. Like there's two different. There's one across Canada, or the local one you can use. Unfortunately, they only from the year to the date of the denial, you have 1 year, which I really am also looking into
Mm.
that because I find that especially if you're suffering mental health, you can't really do anything, and then it's too late. But there's a lot of lawyers available, not available to union workers, unfortunately. But yeah, you have to go the union route, and that's not always helpful in my experience. But yeah, I just honestly, I the most helpful, I don't know what the most, I mean, just never stop asking questions. Like
Mhm.
I tell my story often because I'm not looking for sympathy. I figure that if I might tell one person that will say to me, "Oh, I heard of someone having this happen and this is what they did." So
Mhm.
I feel that way in all of my life, that the more you talk to people, the more you learn and the more you'll find out. And that's what I try. So I don't know if that answers your question
Yeah,
fully.
it does.
Okay, good.
Thank you, Michelle.
Thank you.
I was going to ask around them, now that you are working from home, what what you love, what are those main daily differences
Of working
that
from
you
home,
notice? Yeah, I know you hinted at a couple in terms of your energy level. You mentioned a comment
it's
around, we
phenomenal.
don't have the same amount of energy in a day that other
Yeah, we
people
don't.
do.
Yeah.
So maybe there are just certain things that you now
Even
enjoy.
walking to think about the build, you think about your work building and just walking to the bathroom, how far it is, right? Like it's across the hall. Getting up in the morning, sure, if you're going to be on, which I was often on, like Teams or Zooms, sure, you can put makeup on, but you can stay in your cozies. Nobody knows. I love that. The kitchen's right there. I eat healthier because I'm not like,
Mm.
oh my God, I forgot my lunch. And the commute itself, the stress. We all know that stress scientifically, I mean, my experience as well as science shows that stress exacerbates our condition for sure. Well, I mean, it lowers your immune function. So that in itself tells you how we are. And then stress in a commute can be terrible. Mine to downtown Edmonton area kind of thing is awful. Um, and it's like, so I calculated it out and I figured 2 hours a day I gained back into my personal life. by not commuting, not getting ready for work, not doing those kinds of things. And then on top of that, infections were less. So if you think about my sick time hours, way less working from home, like incredibly less because, well, for different reasons, I'm not exposed. There's all that part of it, measles, COVID, whatever's out there. And then I sleep better. I can sleep in. Um, like till I have to work, like right till the point you have to work. I can take a nap at lunch. I just hop to my bedroom next door and nap. There's so many benefits that benefit me, but benefit the employer, right? Like I just don't get
Absolutely.
what they don't see. So yeah. And the dogs, I love having my dogs. They're at my feet right now. So that kind just stuff like that. There's so many things. And you do tend to work. Like I've asked so many people that work from home. I bet you 90%. Somebody is mentioned, yeah. So I would say 90% in my experience that I've heard just from this, not necessarily, and reading about it too, but um, work, put in more hours working from home because, well, number one, you're dedicated, you're grateful. And so I just was like, I bowed down to my employer, that the one that did accommodate. I was so grateful I did extra for free.
I don't know if you'd be comfortable saying what the accommodation, the duty to accommodate, that the employer said to you, what that was, and how you felt about it.
Oh. They basically said, no, we don't accommodate, like yeah, they just don't accommodate. What you would have to do is, and I worked in an office, but also in clinic. So going back in, I would be working in, I would have to garb up in full PPE, and nobody else is garbed up anymore, right? Nowadays, garbed up is a really bad word but basically full shield, full everything, sitting at
Yeah,
a desk at my computer beside my coworker who's in their sundress or something, right?
yeah,
It's
yeah,
kind of like it felt like a form of well, discrimination and
yeah,
bullying, like, and also like signaling me out, right?
yeah, yeah,
Um, Walking around in the building with all that crap on,
yeah.
and
It's kind of like humiliating you, right? Or
that's the word.
yeah,
Thank you. Yeah.
that's not really an appropriate type of accommodation, because it wouldn't necessarily keep you safe, right?
No. Yeah.
Facing the public in that kind of a
No.
gap,
No.
and stigmatizing you and making you feel weird, right?
Exactly.
Um, and
Exactly.
you think that the duty to accommodate would be have to be something that would be equal, right? Equal to what you were doing prior. I was wondering if you had to talk to any of your colleagues, and if they had, understood about the your need to ask for an accommodation to come back.
They were very supportive in that they saw what I saw, they see what I see, and uh, it's just unfortunate because everything is up in the air where I was working, in the sense that there's 6 nurses that just quit recently in the last few weeks, and it's just a process. I guess they'll figure it out eventually, but it'll be too late for me, and that's okay. I don't think that was my path anyway anymore. Like now I see something different, and I really want to push this issue though across Canada. I want people talking about it. That's my goal. But in the meantime, I still have to pay my bills, so I had to figure that part out, and I'm getting there. So I'm excited about that part of it.
I'm so happy that you found a new path, and it's been a quite a journey for you, but
Yeah.
you've done amazing.
Thank you. Thank you very much.
Would you have asked for accommodations differently or approached
That's
it
a good
differently knowing
question.
what you know now?
I yeah, I think you've got to be extremely, and I have read that in documents that you have to be extremely specific because I think they're more apt to accommodate you um if um if you're specific. And I was flexible though. I did say I had my hematologist write that I'd be willing to do hybrid, like so mo preferably majority at home, but I can come in for meetings if needed, or if they needed me there for something, but they just flat out refused. even at one point, I begged, like I was on a Zoom and they were denying me. And I said, but the job is still going on today, right now, like at that time, and it still is today. But couldn't you just let me do the job I was doing from home until it is transferred over to the regular nurses, like you're suggesting it's going to be? And there was just nothing. I couldn't, no, no, you're going to work frontline. That's where we want you.
Mhm.
Anyway,
Colin, you
so
have your hand up.
Yes, hi. Thank you very much for that
hi,
talk.
Colin.
I met you at the November meeting.
I thought I recognized
Yeah,
you.
yeah.
Yeah.
And like I said then, I mean, so much of what you said uh resonated with the my lived experiences too with the disease and everything, like everything from your childhood to
Oh, wow.
complications in the workplace. And I'm just wondering, like, about the a failure to sort of accommodate is part of this. I'm looking at it and saying it seems to me because it's CVID or primary immunodeficiencies are invisible disabilities that haven't been formally recognized. I know there's a letter from the IPOP organization and was signed by Immunity Canada saying that they should be considered a disability, but I don't think insurance companies view it that way. I don't think employers view it that way. And I think, if you came in maybe with more acute symptoms or and there would be some accommodation, but I don't
Right.
know how you get beyond that because it's almost like you have to provide doctor's letters, and I'm not even sure that those are persuasive to the average person if they just don't want to accommodate.
I agree 100%. Yeah. And I mean, maybe awareness, I still think is the key, right? Like, so, pointing out things like I was saying about the fact that it would be, if it is something that's doable at home, then why not consider it, based on the things that we experience, right? Sick time, our sick hours. Like, I know people that have been let go because they've used up too much sick time. In fact, the person that got me on my journey recently, when I was doing a Zoom session, that's what happened. She lost two jobs, and it set her on her path to take, she became a counselor. And um, so I think, if they recognize that, like, if employers were more aware of the benefits to both, like to them, because they for obviously think of themselves first,
Yes.
but it would be beneficial to them. We are less sick when we work from home for sure.
Yeah, and I mean, what I noticed too from working from home, much like you said, is I was probably spending more hours
Exactly.
working than I was,
Absolutely.
no commute, plus, the computer's always there. I do see some, need for maybe occasionally coming in, but in my former role, I was like, I'm not sure that I needed to be in there except for
Yeah,
on rare occasion type of thing.
exactly. Yeah. And did you find that you would go in for those occasions and then you'd end up, like, do you find that you're more sick the more exposed you get with things?
One of my experiences diverged from yours. Like the common variable that I have, has some problems, but what I found is, and I think a lot of people in the community have this, they develop autoimmune conditions too. And even those you go, well, those are easily treatable.
Well,
Yes,
I
with
missed.
immunosuppressant drugs type of thing. And it's it's just all the complications. It's overall immune problems, like whether it's I don't have enough immune IgG to combat
Right.
or remember a common cold. And then at the same time, whatever antibodies or whatever immune system I've got left is attacking my healthy body. It's hard for
Exactly.
me to explain that to people. Like it would be easier. I had a friend, who had to, be in a wheelchair, and it was like yeah, it looks like it's pretty obvious,
You're
you
so
know,
right. Yeah,
we're disabled in different ways and in ways that can kind of come on quickly. I know my autoimmune condition came on really, really quickly, and it was like, what's
absolutely.
going on? You
You're
know,
absolutely right. Yeah. Yeah, and the invisibleness is you just want to be able to like it's such a hard thing to deal with because you want to tell people, but then you sound like you're being a bit of a pity party person, but
yeah,
but you just want them to understand like what you're experiencing inside your body and nobody sees it really. I mean, unless they understand. But even as a with nursing background, I have a hard time explaining, like I've got Raynaud's now. I've got all these other conditions now on top of that. And I was taught we were on a Zoom the other day, and somebody was talking about their recent really different conditions that I hadn't even heard of, that pop up, and they do, like you said, pop up quick. And I think, you know, I just it's all about awareness, I guess, and educating the public somehow more because it's still not. I mean, you look at our numbers of people that come on, even the sessions in for Community Connect stuff on with Immunity Canada. It's just hard to get that awareness out there. But I really hope. I think that what Immunity Canada's done with the walks, like this past year that I'm aware of anyway, and many more things, is going to make a huge difference for sure. Yeah, for
I
sure.
think your presentation would really shed some light on
Yeah,
the
well, thank you for
problem.
saying that. That's nice.
Yeah.
Thank you. Did I sound a lot more sane today? Because last year, or in February, was it February? I had no sleep that day, so it was pretty.
Oh, I didn't know. I was sitting at your table. You seemed fine to me in that. So,
Oh, that's
uh,
funny. Thank you for saying that.
yeah. And well, and that's kind of part of the problem almost. You look fine. And
Thank you,
so
but you're
whenever
right. I
you
know it's
disabled,
yeah,
like
yeah.
that's how I think the average person kind
Sure.
of
And they don't,
looks at it.
you're absolutely right. And they don't know, like in the understanding of the fatigue, like I used to think, why are we
Yes.
fatigued? But you think about it, our body internally is fighting, like, because it's coming, it doesn't have the same ability. So like it was my hematologist that explained that, like it is in that fight mode. And so that uses energy out of
Yeah.
you. And so then you're tired and we all push through. And I've learned from another person on one of the Community Connect meetings, you have to learn to say no, and you have to learn to listen to your body and just rest.
Are
It's such
those
a
some
hard
of your
thing.
other, sorry,
Yeah.
Michelle, I didn't
No,
mean to cut you off. I was going to say, are those some of your other concerns at work is not pushing through or not finishing a deadline because of your fatigue? Are there any other concerns you still have?
of going back into the workplace.
Yeah.
Yeah, I mean, there's a measles outbreak, right now. Um, I think for me at my age, you know, uh, menopause brain starts to kick in, right? And when you're too young, but when you get there, like the ability to pull out words, like my mom was going through it when I was young, and my sister and I thought she had Alzheimer's. We were sure because she would tell us stories over and over again. So for me to relearn that kind of work when you're not into it, like when it's something that you're forced to do, it's so hard to really embrace it and learn it. Um, Whereas doing that like a course and something that you're really passionate about, I don't know. I mean, it's still a struggle for me to learn though. I'm being like, I mean, learning this new stuff, but they're new age, I would call it. Like they give you grace. They're so compassionate in this course. It's not typical nursing courses. So having that ability to be flexible and learn, but for me to go into the front line and learn hematology, it would be, which is the most difficult thing to learn in nursing, I feel. um, I don't think I don't think I'd be safe with patients even. And I don't know. Yeah, it's just frustrating, but
Oh, that answers it.
Yeah.
Thank you. Yeah.
Yeah.
Thank you for being so honest.
Oh, absolutely. No problem. If nothing
And
else, I am very, very
oh, you
almost to
always are. Yeah.
it.
Any other questions from the group?
Michelle, thank you so much. It's a really compassionate um, history. And also, I worked in nursing for 37 years, and I can remember one of my downfalls was being silent and invisible because I didn't want the world to know my struggles, and that was probably a deterrent, really. So I certainly understand that, and I also love that you're looking at a new path and looking at sort of more alternative holistic modalities. And I think that's fantastic, really fantastic. So congratulations. Thank you so much.
Thank you so much for saying that. Yeah, I think our allopathic system, like our system, is failing all of us. Unfortunately, people have to wait 2 years to get, a scan, knees, whatever, and they're going to need something in the meantime until they can get those things done, like pain control, whatever it may be. So I think, and our system isn't providing that for people. So there's definitely a need for that type of, if you want to get back into it, Jan, there's an idea.
There you
I
go.
you can message me, Ask Immunity Canada for my email because I've told them they can share it, and I'll tell you all about it.
Wonderful. Well, thank you again, Michelle. This was a lovely session. Yeah, and lots of great, I think, motivation and a sense of hopefulness throughout some of that journey. And as it continues, yeah, please keep us updated.
Thank you so much, Meg. I appreciate it. Thank you very much. Thanks, everybody. Thanks, Fiona.
Thank you, Fiona.